Patient case, teenager with multiple concussions, started to get headaches quite frequently. She's noticing that her concentration, fatigue, retention is really low. She's usually a very bright student, but she's having much difficulty with school, not able to do the same kind of study the same amount and retain the same amount of information she was before. She's not getting the same grades as she was before. This is all after a pretty mild to moderate soccer concussion where she took a knee to the head. Now, unfortunately, she's noticed that the other concussions before seem to have kind of compiled upon one another, which concussions tend to do. So they become increasingly worse every time you get a concussion, if untreated, particularly. In this patient's case, upon examining her very quickly, we were able to determine that she has a structural issue in her occipital region of the base of the skull that's inhibiting the normal function of the blood vessels and nerves that are going to her head, creating headaches. So the headaches were very easy to diagnose. A lot of left-sided cervical restriction, a lot of left-sided upper rib and anterior rib restriction, which made a lot of sense because the memory retention, the focus, attention, coordination, stuff like that. There's a lot of right brain type of function. So a lot of that made sense because her left side of her body is restricted, which is limiting the feedback or the proprioception to the right side of the brain, because as we all know, information crosses. So the metabolic rate of the right hemisphere of the brain was reduced. So she's not able to think as well or focus, stuff like that. So that stuff should come back once we release the normal, or restore the normal mechanical function at the occiput, the lower cervical spine, the upper ribs, and the anterior ribs. After treating her initially, she responded very, very quickly. She's not going to take very long at all. She has had this for about 3 months, but she's young and healthy, so it shouldn't be a problem. This has, I guess, baffled a lot of the other doctors she's seen over the past 3 months. She's had a couple CT scans, revealed nothing, of course, because it's not a pathological issue, it's a functional issue. So I wish we could have seen her a little earlier, but that's okay. She's had a little bit of issue with lightheadedness when it first started, but that's the feedback issue from the base of the skull in the left cervical spine, which affects the vestibular regions of the brain, which give you balance, coordination, or your perception in space, body awareness, if you will. Those were affected. Not as much now, but we're going to really improve that with the treatment here, which is also going to, of course, feed that brain what it needs more. So she's going to be able to think faster, think better, retain information, better focus, memory, all that stuff. So she'll do really, really well. Parents are traveling away, so we have to do this rather quickly, as we always do. She's going to have some exercises at home for the right hemisphere of the brain. We can do some eye exercises, and she should be doing very well in about 2 to 4 weeks. Have her back to normal, and her grades and stuff will be back, and she should be able to get back into athletics very well. So the area of the occiput here's the base of the skull here. Okay, the occiput is right here. Okay, and that area on the left side is very restricted with her, and that's impeding these blood vessels and nerves that are exiting the spine here and going to the rest of the head. The lower cervical spine and through here is also very affected, as is the right C1 or atlas area, which is giving her pain below her ear. Now the upper ribs here are restricted, as they are on the anterior side, reducing normal rib expansion and oxygenation for the patient, inducing headaches and also making it difficult to feed the brain the oxygen it needs and concentrate. Now, as you can see, a lot of these are left-sided, like we said before, so the left-sided issues going to the right brain are reduced because these are restricted normal motion, so the right brain is not receiving the information it needs. Therefore, she's having problems with fatigue, or memory retention, fatigue when reading, focus, concentration, along those lines. The dizziness and vertigo is because these issues here are not feeding that vestibular region of the lower brainstem, vestibular nuclei, and then the brains in the vestibular nuclei out here, vestibular apparatus, I should say, causing a lot of issues with the proprioception. Like I said, she should respond very well, and I will see her back in a couple weeks here.